Representative Mary Benton, District 73. Chairman, colleagues, thank you so much. It's exciting to start another year offering public health, and I welcome our new members. This is definitely one of the most exciting committees that we have here in the House chambers. I'm bringing to you today House Bill 1035. As most of you know, Arkansas is ranked in the nation's health right now at 48. Although that's better than 49th where we used to be, we have a far cry to go from our state to get health. And it's really, as a member of this committee, I have been looking at it and looking at the insurmountable cost of Medicaid going forward and just looking at things, what can we do as a legislator to make a difference? And those are things that I've looked at in the interim. What can we do to make a difference in Arkansas and the health of Arkansans and decrease the cost of Medicaid? Those things are really forefront on my mind. So I'm really pleased that the governor has brought forth Healthy Active Arkansas. I think it's a great plan. It's a great thing that we can do to get Arkansas healthier and get us far from 48th and up to 30th. I'm really excited what the governor's doing. HB 1035 that I present to you today fits in perfectly with parts of the governor's plan to promote purchase and consumption of healthier food. According to a recent study released by the Food and Nutrition Service responsible for running the food stamp program, soft drinks were the #1 purchase of commodities bought by food stamp recipients shopping at a single U.S. grocery retailer. Bagged snacks were #4, and candy closed out the near top 10 at #11. If the numbers had been included for convenience stores, I can guarantee those numbers would be much worse when it comes to junk food. Today's food stamps, These poor food choices are certainly part of the reason why the highest rate in obesity in our state is among those in the lowest income. Arkansas is the 6th most obese state in the nation, and in one of the schools in my district alone, we have increased obesity in 1 year by 10%. Obesity greatly increases the chance for a number of diseases, as we all know: high blood pressure, heart disease, strokes, cancer. Along with these negative health issues, we have got decreased self-esteem, decreased productivity, and the loss of quality of life. Obesity-related diseases in our state cost $1.25 million annually. 40% of that comes from Medicaid and Medicare. If we have any hope of bending this cost curve of Medicaid in our state, we've got to do something to make a difference. We can just continue acting like this doesn't exist and the legislature has no part, but we as a legislature can make a real difference, and that's what I want us to do today, is some common sense legislation that will actually make a difference in the care and the health of Arkansans. We cannot ignore this issue and think that things will change. This common sense legislation will simply incentivize food stamp recipients to purchase what they were meant for, food that we can use to feed their families and decrease hunger, not for junk food that will help delete obesity and poor health. Not only will less junk food decrease the rise in obesity, it will help to improve the health of low-income Arkansans. Foods that are devoid of nutrition weaken the immune system and making the recipients far more susceptible to infection and disease. As a registered nurse in our state, I care about the health of Arkansans. That's really one of the main reasons that I'm bringing this forth. I care about the kids in our state. I want the kids in our state to have sippy cups that are full of good fresh milk from Arkansas dairies and fruit juice, and not Mountain Dew and Pepsi. That really decreases the dental problems in our state. Those are so many things that this addresses. We've seen a 172% increase in the number of food stamp recipients in our state, and yet we have rapid increases in hunger. We just heard from the director today that we're the highest rate of senior hunger in our state. Food stamps is not working. Food stamps is broken, and food stamps needs to be fixed. We have 418,000 Arkansans participating in the program, and yet hunger continues to rise. I think not only does the current system provide for poor food choices, we also have a problem with EBT cards being sold. We saw recently in Sebastian County where 94 food stamp recipients' EBT cards were used by some convenience store owners to go and purchase food for their convenience stores. We have a serious problem. When I visit with law enforcement officers in our state, and I say, what can we do to make a difference in our state to cut down on the drug problems? They say, cards being sold, EBT cards being sold, are a huge reason for the drug problem that we have in our state. I want to make these food cards a little less incentive for people to sell them. I want them to be used for the reason that they were for, to decrease hunger in our state. Food stamps were started as a program for farmers to purchase, for farmers to get rid of excess commodities and to help the hunger in our state. We have gotten so far from that, from what it was meant to be. I'm asking you, my colleagues, today to be courageous, to make a difference, and to say, in Arkansas, we care. We care about healthy food, we care about our kids in our state, and we want to make a difference. And with that, Chairman, I would appreciate the vote.